Hi, welcome to the nursing lab. Something's wrong with our IV. First thing I'm going to do usually is press silence because the beeping gets people really anxious. What I'm going to do next is I'm going to follow my tubing because most of the time it'll tell you the warning here and it says distal occlusion, which means it's been kinked off. Maybe they bent their arm, something like that's going on. So you always want to look at your alarms because it'll give you at least a hint of where you're looking at. If I don't see any kinks and it's not in their AC and they said they haven't bent their arm or anything, that means it's time to check out some of the other issues that might be going on. So we're going to continue to follow this all the way down the arm, and once we realize that the IV tubing is not our issue, something else is, we're going to really want to make sure we're assessing the arm. So the first thing I usually notice or look for is I look to see if their tissue is swollen. There's a lot of things that it can be from being swollen, but it's important for us to understand if it's swollen, there's something going on. If they say no, it's not swollen and it's still, the IV is still alarming, we can't figure out. I'm also looking then at the color. Is it red? Because if it's red, that means that there's some sort of irritation going on. One of the really interesting ones that really isn't swollen but does get red is what we call phlebitis. And that's when we have a vein that gets irritated from the medication that we're giving. So this is a picture of phlebitis I got off Google. I'm sure you can find one if you put phlebitis in. And you can see that that redness, here's the IV insertion site, and it's followed the vein, and it looks like we've got some trouble going on here. Not exactly sure what's going on with that person. Usually phlebitis is going to be tender and cause some discomfort, and we're going to want to make sure we're keeping an eye on that patient. Whatever it be, I'm definitely stopping that medication and either seeing if we can dilute it more, change it to a new vein, something like that, because we're going to get into more complications if we keep running it through that vein. The other part, so okay, swollen. Is it swollen? Yes. Well, the next thing I'm again looking for is I'm looking at that color. So is it red? And if it's not red, if it's just swollen, not red, and it's cool, then I'm touching it. Is it cool to the touch? Because probably the biggest thing, if it's not red and it's still swollen, it becomes cool to the touch. What that means is we have what's called an infiltration. And an infiltration is where the IV or the fluid gets out of that vascular system and it kind of seeps or infiltrates into the tissue around it. This can cause a problem, one, because the medication's not getting to where it needs to be, but also because it's really uncomfortable and that arm can get really big really fast depending on how fast your IV rate is going. If you were giving something like normal saline, LR, those kind of just fluid maintenance kind of things, infiltration is not a huge deal other than it's just a little uncomfortable. We're going to kind of treat it like edema, right? With a warm cloth, elevation, that kind of stuff. So we'll get their arm up, we'll put a warm cloth around it, definitely take out that IV and put an IV in a different site because you don't want that. If we get it's red and we say yes, okay, and then we're like, okay, well, same thing here, I want to feel it, and now it's feeling hot. We've got a big problem. So that's when I want to know what medication was going, because we've got some medications that are pretty dangerous. Oh, sorry, spelling has never been right. Okay, med, there we go. What med were we giving? Because there's medications that we give that are really dangerous to the tissue if they get out of that vascular system. That medication is usually classified as a vesicant. You're going to know it when they send it up to you from pharmacy that it's a vesicant. Zosyn is a vesicant. Different chemotherapy medications are vesicants. And that means that when that infiltrates, because it's swollen, it's gotten out of the tissue, but now it's hot and red, something is going on. We've got a swelling process going on inside there, and we have a vesicant. Now, if we have a vesicant, that's then called an extravasation, which is a really fun word, if you can say it. Extravasation, okay? There we go. Extravasation. that means that that medication has gotten out into the tissue and is causing all sorts of issues with that. So here's one that I found on Google, that here you have like an infiltration. You can see the redness happening, the swelling, but then after a while, we have to go down and do an irrigation and debridement on that kind of patient to take care of that. A lot of those are really when you see the nasty gory pictures all the way down to the tendons and the hands and stuff, because they've had to go that far down to clean out all the damaged tissue from the medication going on. That becomes a call to the doctor. That becomes a call to get some help, definitely getting that IV out of there, getting that medication out of there, and then starting a new IV somewhere else, making sure in order to prevent vesicant from getting outside the vessel, we want to check blood flow every time we give those types of medications, so that we know that there's good blood flow. We know that that medication is getting into the vessels and not leaking out into the tissue and causing the damage. So those are some of the kind of issues that can happen as complications. So we've got an infiltration, extravasation, which is the infiltration of a vesicant medication, and phlebitis. Those are probably the biggest three. Infiltration is probably the most common one that I've seen in my career. Only a couple extravasations, but I was a chemo nurse, so I've given a couple of those drugs and seen some of the problems that happen when that gets out. If you have any questions, please let me know, and I'll talk to you later.